Hello, I'm John. I'm 73 years old and my bladder cancer story began a year ago. I've decided to make a series of videos talking about the experience in the hope that it might be helpful to others going through a similar situation. If you've come here, then you'll most likely be aware how worrying it feels, and to not know what is going to happen until it does just adds to that worry. I wish that I'd had someone to talk me through some of what was to come. I know that outcomes vary, and so some of what follows in later videos may not all be relevant to everyone, but the early stages of the journey will be pretty well common to us all. And of course my experiences are from a male aspect, but apart from the obvious anatomical differences, it will be the same for females. So, how did I discover that I had bladder cancer? Well, in the classic way of noticing blood in my urine. The first time I didn't really give it much thought. I noticed my urine was red and I just thought, oh, I wonder what I've eaten to cause that, and then forgot all about it. A few weeks later it happened again. When your urine mixes with the water in the toilet, it's diluted, but there were a few drops on the side of the pan and they were very red. I thought, that looks like blood. And then I remembered it had happened once before. So, as you do, I googled it, and of course all sorts of options came up. Excuse me. One that occurred was that it could be a result of strenuous exercise and was common among cyclists. Well, it just so happened that I'd been on a fairly long bike ride the day before, and so I thought, that'll probably be it. I hadn't really heard of bladder cancer at that stage, and of course you look for an explanation that means everything's okay. A few days later I saw a good friend who's a retired nurse, and so I mentioned it to her. Her immediate response was, "You need to get that checked out." So I sent a message to my doctor's surgery, and the next day I got a reply asking me to take in a urine sample, which I did, although there was no longer any visible sign of blood. I waited a week and then rang the surgery to enquire about the results. They told me it had come back inconclusive and could I take another sample, which I did, but again no signs of blood were visible. Another week went by and I rang again and was told that there was no sign of any infections and the doctor had signed it off as no further action required. A few days later I saw my friend again and she said, "But there shouldn't be blood in your urine, and the NICE, which is the National Institute for Clinical Excellence, the NICE guidelines say that if there is, your doctor should send you for a scan." So there's this part of me that wants to believe that the doctor knows what he's doing, and who am I to challenge him? And anyway, I'm relieved to hear that he doesn't consider any further action necessary and I can just forget about it. But my friend the nurse is insistent, and so I call the surgery and say, "Okay, there's no infection, but can the doctor explain why there might have been blood in my urine?" The receptionist says, "Yes, she'll ask the doctor to contact me." Another week goes by and I haven't heard anything. And then a fortunate coincidence happens. The nurse practice at the surgery contacts me to say that I'm due for the regular health checks that you receive after turning 70, and an appointment has been made for me in a couple of weeks' time. I duly go for the appointment and after the checks explain the situation to the nurse. She checks my records and says, "Oh, there's an action outstanding for the doctor to contact you. Haven't you heard anything?" When I say no, she says that she'll chase him up. The next day I get a message from my doctor to say that he's requested an ultrasound scan of my bladder and I'll receive an appointment through the post in the next few days. Now, hopefully you won't have this experience, but I've laboured it here to press home the point that you must persist and not give up, because as subsequent events will tell, it would have been a disaster if I had not continued. My ultrasound scan appointment arrived with instructions that I must drink a litre of water 1 hour prior to the appointment time and then not go to the toilet until I've had the scan. Well, at my age it's tricky to hold that much water for an hour, especially as I had to wait a further 30 minutes for the actual scan. Then the radiographer put freezing cold jelly onto my bare abdomen and started pressing the scanning pads onto my bladder in different places. It only lasted about 5 minutes, but I couldn't wait for her to finish so I could rush to the toilet. The radiographer won't tell you anything except that the results will be sent to your doctor. And about a week later I received a letter that there was a growth in my bladder and I was being referred to urology investigation. So now I knew there was something inside my bladder that shouldn't be there. Naturally I started to get a bit more worried, but I still held out hope that it would turn out to be just a benign growth that could be removed, and that would be that. The appointment that came through was to attend a flexible cystoscopy at the urology investigation suite of my local hospital. They refer to it as a flexible camera, and that's exactly what it is. A camera on the end of a flexible tube that goes up your urethra into your bladder for a look around. The urethra is the pipe that carries urine from the bladder out of the body, and so for a man it's through the penis. You don't need to do anything to prepare for this procedure. You'll probably be asked to provide a urine sample when you arrive just to check that you don't have any infections. A nurse will call you into a room where the urologist will be waiting, and in my case there was a second nurse there who I think may have been a trainee. You're asked to go behind a screen and remove clothing from the waist down and put on a surgical gown. You then lay on a bed for the camera to be inserted into your bladder. First of all they clean you up, then apply an anaesthetic gel and lubricant before sliding the camera up. It doesn't hurt, but it feels a bit uncomfortable. The camera relays pictures to a screen which is in front of you. It's up to you whether or not you want to watch the screen. I'm usually pretty squeamish, but as it was my body, I wanted to know what was going on inside, and so I did watch. What I saw was a growth hanging down inside my bladder that looked sort of like a squid with numerous tentacles. After sliding the camera out, they asked me to turn onto my side while they checked my prostate. I don't know whether they inserted the camera, but I didn't feel anything at all. The whole procedure lasts about 10 minutes, and then they clean off the gel and ask you to get dressed. I was invited to sit by the urologist, who showed me a photograph of the growth, and he told me that it was a large 5 centimetre papillary superficial bladder tumour. I found out that meant it was growing into my bladder away from the lining rather than into the lining, which is apparently a better option for removal. He told me that I would be sent for a procedure called TURBT, which is an acronym for transurethral resection of a bladder tumour. He told me that the procedure would be performed under general anaesthetic and involve an overnight stay in hospital. And he also warned me there was a possibility that I may have to be catheterised for up to 2 weeks after the procedure. That's all I wanted to cover in the first video. I'll record another where I'll talk about the TURBT and what happens afterwards. So if you found this interesting, then please check back shortly. I'll put a link in the description below this video when it's ready. I hope this has been helpful, and I wish you good luck with whatever you're going through.